So congratulations, you've completed your case assessment interview. So let me highlight some areas that would be important in conducting an interview such as this. Of course, you conducted your next steps in formulation with the client and the client has terminated. And so in terms of a diagnosis, you really didn't have a lot of information to come up with, say, a bipolar diagnosis, especially where there are other substances involved, such as caffeine and insomnia involved. One of the biggest questions that would have been extremely important that I hope that you ask was, how long has the client gone without sleep? Clearly in the history, the primary care provider saw that as an issue and issued trazodone 150 milligrams QHS that happened approximately a year ago. However, the client did not continue that because the client had experienced an adverse reaction to the trazodone, and really was an adverse, maybe not. Had the client been seeing an outpatient provider and a return to the PCP, perhaps some education could have been in line regarding taking trazodone at least 8 hours before wake, taking it an hour before going to bed, and allowing the body to rest to minimize the hangover feeling. So one diagnosis that might be appropriate for this client is insomnia related to caffeine intake with a rule out of bipolar disorder. The client did share some information regarding family history in that it was believed that the maternal grandmother had a period of time in which she had hospitalizations and was exhibiting excess energy. Although there wasn't a definitive diagnosis that the client reported. There's some question as to a mood disorder, and so a follow-up question could have been, do you know if your maternal grandmother was treated with medicine, and what medications would that have been? Had been asked, the original scenario would have indicated that the maternal mother was in fact treated with lithium, and so asking the questions around how many hours of sleep is the client getting, how close is the caffeine intake being taken. Near bedtime is also important. Understanding that caffeine typically takes an hour to kick in and can last 8 or more hours, and so, if the client has been ingesting enough caffeine, in this case, it was over 3 cans a day, and certainly close to bedtime, that would be enough to create a situation where the client is not getting enough sleep, so that critical education would be a big piece to make an informed judgment.